Welcome to the 2024 TPA Board of Directors Candidate Forum. The Texas Pharmacy Association Nominating Committee, chaired by immediate past President Carter High, selected this slate of candidates from the many nominees put forth by the membership. This presentation is designed to help you learn about the candidates and what they hope to accomplish if elected to the TPA board, as well as their vision for the future of pharmacy in Texas. TPA members eligible to vote will receive their ballot via email on Monday, July 29th, with the ballot staying open through Monday, August 12th. Now, to meet our first candidate for President-elect, Ann Hampton.
Hello, my name is Ann Hampton. I am applying for TPA leadership. I've worked in a pharmacy since I was 16 years old. I graduated from Texas Tech in 2002. I returned home to rural Northeast Texas and began working with James Paul Myers, past TPA president. He taught me much about pharmacy, owning a business, and professional advocacy. Myself and Leslie Lang purchased Paris Apothecary on Independence Day, 2007. Pharmacy has treated me well, and it's time to give back. The pandemic showed pharmacy's worth. In my case, my store provided masks to teachers, made around 1,000 gallons of hand sanitizer to fill the gap during the shortage, added COVID vaccines to our vaccine protocols and COVID testing to our point-of-care testing programs. We developed policies and procedures to provide safe areas to administer over 1,000 doses of antibodies for those with COVID and high risk of complications, all while maintaining our everyday practices. There was no virtual resources for pharmacy. We had to stand the line and not only bravely continue our daily work, but expand our profession to meet the need. We are COVID heroes, but our work isn't done. We must advocate for our profession and with a united front. It has been my honor to serve as a current TPA board member, past GAC member, past Awards Committee, Affairs Committee, and Policy Council member. It was the absolute highlight of my career to be recognized as TPA's 2021 Pharmacist of the Year. But our work isn't done. Pharmacy has the history of being splintered, but during these unprecedented times, we are becoming united. We must continue on and preserve the honorable profession for the next generation. If you choose me to represent you, I believe we must continue the PBM reform and unity of our profession. PBM abuse affects all of pharmacy. We must free ourselves of their tyranny. We must prevent them from cheapening our profession and mold our profession into what we want it to be. My vision aligns with TPA's to unify, strengthen, and protect the profession. To take care of our patients, we must take care of ourselves. Patients deserve quality, personable health care. Thank you.
For President-elect, Jason Davis.
Hi, my name is Jason Davis. I'm running for President-elect of the Texas Pharmacy Association. Currently, I serve on the board as the Vice President. Previous position held was Speaker-elect of the House of Delegates. I've been involved in the board for a little more than 3 years. I'm a 29-year pharmacist. I have, in my day job, I work as the Senior Manager for Pharmacy Compliance and Regulatory Affairs for HEB Pharmacies. A lot of what I do in my day job actually does intersect with what we do on the board of TPA. And it's been a really rewarding experience being a part of it. I have a passion for this profession. I've been involved in this profession for, advocacy for this profession for a long time, not just with HEB, but in my previous role at Walgreens. I feel like in the state of Texas, we have a lot of work to do along the lines of trying to advance the profession. We certainly have done a lot of great work so far. And I think TPA really does a great job of representing all segments of pharmacy in the state of Texas. They've done a great job of aligning the different organizations and groups to try to make sure that everybody is really on the same page in terms of what we're pushing for, what we're fighting for, and what we might be fighting against. Certainly, the role of president on the board is very important with determining the direction of the organization. We have a fantastic board. It's very diverse. People that have a lot of experience in a lot of different areas of pharmacy. And it's been very rewarding, like I said, for me to be a part of it. And I feel like as president, it's a next logical step for me. I feel like it's a role where I'll do very well. Like I said, I have a passion, and I'm gonna, I like getting out there and talking to people and really promoting the profession and in a positive way, and really just letting people know how great it is what we do day in and day out. We have a lot of challenges right now, and we're not immune to those challenges at my own company. So we're feeling the same pains as everybody else. I really feel like we have a great opportunity in this state with a very aligned Texas Pharmacy Association. I think we can get a lot of things done going forward. I would be coming in during an interim session, so that would probably be a little bit different, but that's a great opportunity for you to really get out there and find out what's most important to people so that we can set up what we're going to do the following year during session. So I'm really hoping that I get your support and get the opportunity to continue to serve on the board. Like I said, I've been around this profession for a very long time. I've seen a lot of changes, and I'm looking forward to some of the changes that are going to come up as we continue to push for things. We've gotten very, very close with in certain areas like immunizations, test and treat, and certainly PBM reforms. So that will be a lot of my focus as the president of the board. So hopefully I can count on your vote and look forward to seeing everybody in July. Thanks.
For Vice President, Lauren Sokol Corrales.
Hi, I'm Lauren Corrales. I'm a pharmacist with Carvajal Pharmacy in long-term care, where I've been for 11 years. Outside of work, I'm a mom of 3 young boys, so my hobbies include dinosaurs, Play-Doh, and watching Bluey. I'm currently treasurer of TPA and also on the Farm Pack Board of Directors. I'm on the Public Policy Council as well as the Association Affairs Council. I'm on the Texas State Board of Pharmacy's PMP Advisory Committee and also involved at the local level as past president of Bexar County Pharmacy Association. I've enjoyed serving on the board of directors for the past 2 years and would like to continue working with these great leaders we have and keep advocating for the profession of pharmacy. I really want to encourage others to get involved, stay up to date and informed on current pharmacy legislation, and encourage them to get out to the Capitol, meet with their representatives, and advocate for our profession. I'll be honest, when I went to my first pharmacy day at the Capitol, I was so nervous. I had no idea what I was doing. I'd never met with a state representative, and I knew of the issues and concerns pharmacy is advocating for, but wasn't sure how to educate state legislators and their staff about the importance of pharmacy professionals in our communities. I'm very grateful that TPA has provided advocacy training and the opportunity for those like me without any experience to become educated and gain confidence to educate our legislators and advocate persuasively. After attending training and discussing with other pharmacists that have met with representatives, I was no longer nervous. I was confident and was able to go and speak to the representatives and their staff and confidently advocate for pharmacy, and I would love to share my experiences with other pharmacists and encourage them to be the voice of Texas pharmacy. I would really like to continue serving on the board of directors, and I'd really appreciate your vote. Vote for me, Lauren Corrales, board of directors. Together, pharmacy advances.
For Vice President, Rannon Ching.
Hi, my name is Rannon Ching. I'm a pharmacist here in Austin, Texas, and I run an independent pharmacy called Tarrytown Pharmacy. I am running for the vice president position of the Texas Pharmacy Association, and I would love to have your support and your vote. I've been able to serve on the board of directors for the past 5 years since 2019, first as the Speaker of the House, and most recently as one of the directors of the board. And in my time, I've been able to serve with members, with the board, and pharmacy leaders in our profession, and the TPA staff to really work together towards the common goal of being able to advance the profession of pharmacy. I would like to run for vice president to continue the work that I've done and to continue all the great things that we've been able to do over the past 4 to 5 years and to continue to make the profession of pharmacy as strong as we can. So my goals as vice president would be the following three things. First would be to engage and to increase membership of both pharmacists and pharmacy technicians. Our pharmacy technicians are an integral part of our teams, and we really need to utilize all of our pharmacists, all of our technicians. It doesn't matter what the practice field is, it doesn't matter where you're located in the state. We need to speak as one voice, and we need to be able to gather all those voices under one banner, which is TPA. Secondly, we need to be able to provide new clinical services and opportunities for pharmacists and our teams that are beyond just dispensing medications. In the next 1 to 5 years, there's going to be such a need in our community, in our nation, in our state for healthcare access and for healthcare needs. And we as pharmacists and as pharmacy technicians are so well poised to be able to help in those areas. However, in order for us to be able to do that, we need to find legislation that supports our ability to do so. And we also need to work with insurances and payers that are going to be able to pay for our time and be able to pay for these services that are going to allow us to hopefully keep these healthcare costs in check, keep our patients healthy. And so we need to be able to continue to fight, promote, and find new ways to do so. And lastly, we need to continue to advocate for the profession of pharmacy through legislation and through advocacy. And what that means is we need to not only have people that may not be comfortable with legislation and advocacy, like myself, even 5-6 years ago, even today, there's always things that we can be learning and finding out and reaching out to our local politicians to be able to just share our story of what we do as pharmacists and as members of our community. And we need to be able to not only encourage and equip our other members, pharmacists, pharmacy technicians, to join us in that advocacy. We need to speak as one voice, like I mentioned earlier. So I would love to have your support. I would love to speak with you and answer any questions that you have, but I appreciate your time, and I would appreciate your vote for myself as the Vice President of Texas Pharmacy Association. Thank you.
For Treasurer-elect, Robert Emfinger.
Hi, my name is Robert Emfinger, and I am owner and pharmacist at Kemp Family Pharmacy, an independent pharmacy located in Kemp, Texas, about 50 miles southeast of the Dallas-Fort Worth area and about the same distance southwest of Tyler. I've been in practice here since the fall of 1984, when two partners and I bought the pharmacy from Ed Horton, a longtime TPA participant and active member. I've owned up to 3 pharmacies over the years, and now find myself with 2, and looking to focus on the future of what pharmacy looks like in conjunction with filling prescriptions. Pharmacy has gone through many changes during my time working, and I've tried to keep my pharmacy relevant and in front of what seems to be happening in healthcare. I want to always practice and provide others with the opportunity to practice at the very top of what our license will allow. I have served the last 4 years on the board for the Independent Pharmacy Academy, and now would like to continue serving as a board member for TPA. Many of the issues facing pharmacy will require things to happen legislatively. And as you know, those wheels turn very slowly. I'm in the twilight years of practice, and the changes needed will not help much the way I practice pharmacy what I do. But what I do and the efforts put forth, I hope will ensure or enable future pharmacists to practice pharmacy the way they want to and the way they should. The future of pharmacy is bright, provided we set our sights on the future and work together to take our shot at the bullseye of what tomorrow holds. Yesterday is behind us. Today is a work in progress. But tomorrow, it's whatever we make it. Thank you for the opportunity to serve as a TPA board member.
For Treasurer-elect, Casey Nicholas.
Hi, my name is Casey Nicholas, and I'm hoping to serve as your next treasurer-elect for the Texas Pharmacy Association. I'm a pharmacist and healthcare supervisor with Walgreens based out of San Antonio. As a healthcare supervisor, I support the pharmacy operation in about 62 stores from Northeast San Antonio to West Houston. I also serve as the clinical, regulatory, what should you do in this situation, expert for those pharmacists, technicians, and interns. I've been with Walgreens since 2015 when I started as a staff pharmacist before I quickly moved into a leadership role when I discovered I loved leading teams. I've also run one of our Village Medical co-located sites and one of our community-based specialty sites where I got to learn all about the world of specialty pharmacy and how to run that operation. I want to serve on the Texas Pharmacy Association board in order to support the mission of the association, to elevate the profession and advance the practice of pharmacy to care for patients. I've worked with TPA as well as other pharmacy groups over the past few years in order to support pharmacy legislation. I've testified in support of our immunization bill on a couple of occasions. I've come to the Capitol to meet with legislators to talk about the impact that passing these bills would have on our profession, whether it be PBM reform, Medicaid rate floor, test and treat, our immunization bill. All of these are so important and can impact our daily work, and it all starts with advocacy. I've also talked to my peers about the importance of advocating for their profession, and a lot of them have gotten involved in these grassroots campaigns around the state, as well as come down to the Capitol to talk to their own representatives about the importance of these bills. One thing that I think is really important is to communicate about how advocacy has many different forms. It's not always going to the Capitol and testifying in front of the state Senate. It can be as simple as picking up the phone and voicing your support of a bill when it's on the floor, or joining your state association. All of these things are incredibly important. When I think about the future of pharmacy in Texas, one thing really comes to mind, and that's access to care. Something that I really hope we accomplish during this next legislative session is making sure that technicians are able to immunize patients, making permanent what we have done during the PrEP Act. Now, I want to make sure that we advance that and make sure that our technicians are able to immunize all immunizations, not just COVID and flu. I would also love to see our pharmacists doing more for patients in their communities, whether that's seeing a test and treat bill come to life, pharmacists administering PrEP, helping with travel care. There's so much that we see pharmacists doing and getting paid for in other states. I'd love to see some of that happening here in Texas. We have the training, we have the knowledge, and we're so accessible in our communities. I thank you so much for your consideration of my position as treasurer-elect on the board, and I look forward to serving the Texas Pharmacy Association if elected to this position. Thank you.
For Director, Position 1, Shawn Ahmad.
Hi, I'm Shawn Ahmad, and I'm asking for your vote to be a director on the TPA board. As PIC of an independent pharmacy, I understand the challenges we face, such as low reimbursement. In order for us to continue to serve our patients, it's imperative for us to fight for fair compensation for our clinical services and reimbursement for dispensing. I also understand the importance of collaboration amongst ourselves as pharmacists and also with other healthcare providers. I'm running because I'm excited about the future of pharmacy and believe that TPA is the premier organization leading our profession here in Texas. Over the past 10 years, I've been dedicated to TPA's excellence, serving in the House of Delegates on several committees, including public policy and association affairs, and also as a trustee on the TPF board. I have a proven track record of being willing to serve TPA, whether it's reviewing applications for scholarships and awards, judging and running student competitions, or helping to fundraise at TPA conferences. If elected as your director, I pledge to bring my unwavering dedication, experience, and passion to advocate for our profession. I will champion the role of pharmacists as an integral member of the healthcare team that needs to be compensated accordingly. I am humbled to have won the Distinguished Student Pharmacist and Distinguished Young Pharmacist Awards. With your vote, I am eager to bring the same passion and drive to the board. Thank you for your consideration. It would mean a lot to have your support.
For Director, Position 1, Laura Edmundson.
Hello, My name is Laura Edmundson, and I'm asking for your vote for the Texas Pharmacy Association's Director Position 1. I've been a pharmacist for 14 years and was a pharmacy technician for 4 years before attending the University of Houston College of Pharmacy. My entire career has been spent with Berkshire Brothers, which, for those of you who may not be familiar, we are a grocery pharmacy chain based in East Texas, but serving mostly rural communities across East, Southeast, and Central Texas. I'm currently the Vice President of Pharmacy, though I've held several roles over the years, including Pharmacy Manager, District Director, Clinical Director, and Director of Pharmacy. And though I can't say I'm the owner, I am proud to say that I'm one of 6,000 employee owners, as we are a 100% employee-owned organization. And because of that, I take any threats against our profession personally, as any pharmacy owner would and should do. One could say that I've just recently entered the advocacy era of my career. There's no doubt I'm getting a late start, though I've been a member of TPA for several years. Upon graduation, I worked diligently to advance my skill, knowledge, and career as a pharmacist, as most of us do. Unfortunately, I paid little attention in those early years to what I should be doing to help advance the profession as a whole, because life was busy. But I've come to realize that life will always be busy, but we must make time for what's important. And what's important right now in our profession is unity and advocacy. It's not letting others make decisions for us without our input. It's fighting to protect the sustainability of pharmacies in our communities. And it's relentlessly pushing to be recognized and treated like the healthcare providers we are. If elected to the board of directors, one of my goals would be to help increase membership, as we all know that the more of us there are, the stronger we become. And I have a feeling there are a lot of pharmacists and technicians out there who, just like I was, may not really know how they could help the efforts of our profession, or maybe they're just now becoming interested in advocacy because they're feeling the effects of the operating environment we're currently in. My vision for pharmacy is one where clinical services like test and treat, expanded immunizations, and disease state education are commonplace at community pharmacies across Texas. I'd like to see pharmacies not treated like fast food establishments and dispensers of products, but instead as providers of service. But in order to ensure there are ample pharmacies left to provide those services, advocating for PBM reform is at the top of my list. I realize I'm probably the candidate with the least advocacy experience under my belt, and that's okay. If nothing else, I hope that my desire to become more involved in advancing our profession will inspire others to do the same. After all, we're all in this together, but I sure would appreciate your vote. Thank you.
For Director, Position 2, Daphne Hong.
Hi everyone, I'm Daphne and I'm excited to share my candidacy for a director position with TPA. After earning my Doctor of Pharmacy degree from the University of Texas at Austin in 2014, I have proudly spent my career serving Texas patients in both retail and home delivery pharmacy, starting as a Walgreens pharmacy manager, then a lead pharmacist at PillPack, and now the pharmacist in charge at Amazon Pharmacy in Austin, Texas. I've always been driven by commitment to continuous learning and curiosity for innovation, which led me to join a small startup called PillPack in 2016. Through this journey, I have crafted policies, I have spearheaded initiatives, including launching a drone delivery pharmacy and same-day service to improve access and convenience for Texans. I feel that pharmacists inherently possess the leadership qualities and capabilities to make valuable contributions beyond our current, often limited roles. Advocating for initiatives that open up new avenues for professional growth and development will expand our skill sets, promote innovation in care delivery, and help improve patient access to care. My vision is a future where pharmacists are recognized as leaders in healthcare innovation, supported by ongoing development and a steadfast commitment to patient-centered care. I believe strengthening relationships with healthcare and government stakeholders will be crucial for successfully advocating policies that recognize the vital roles of pharmacists. I am committed to leading with confidence, drawing from a proven track record of adapting and thriving to changes. As a candidate with innovative background in home delivery, I bring unique perspectives that will support membership growth and foster dynamic interactions in the Texas pharmacy space. Your support and the upcoming election would mean the world to me. Please reach out with any questions and don't forget to vote.
For Director, Position 2, Lauren Clark.
Hi, I'm Lauren Clark. I'm a proud community pharmacist with HEB Pharmacy based in Austin, Texas. I'm running for a director position on the TPA Board of Directors. In my current role, I manage a standalone HEB pharmacy located on the campus of the University of Texas at Austin. Hook 'em horns. In addition to my role as pharmacy manager, I assist the college with the patient counseling course and serve as a residency preceptor for the HEB UT Community Pharmacy Residency Program. I believe in the importance of showing up and being an active voice for the direction of our profession's future. Having previously served on the TPA board, I was able to gain an understanding of the complexities, challenges, and opportunities facing pharmacy in the state of Texas. I'm ready to bring my experience back to the board to continue advocating on behalf of Texas pharmacists in all areas of practice. As we enter a new legislative session in Texas next year, it's vital that we continue to highlight the importance of pharmacists in the healthcare continuum, promote patient access to affordable care, and work to increase professional growth and expanded roles for pharmacists in the state. Thanks for your vote.
For Technician Director, Serena Spurlock.
My name is Serena Spurlock. I'm the Operations Manager for Outpatient Pharmacy Services. I have 29 plus years of pharmacy experience. I've worked in every area except for nuclear medicine and mail order. I'm a people person, so I don't think mail order would actually fit my personality. I love being in the day-to-day operations with the team. And I would like to be a member of the board to help bridge the gap for some new technicians and also be a part of the voice in bringing information to the board as well as to the organization as well as to other technicians that I work with or that we wind up teaching with the different schools that we work with, to let them know it's important to be a part of different organizations and that your voice can be heard and you support it, and that's part of the professional organizations. They support everyone, not just the pharmacists and the students. They actually support the technicians. And then where I see technicians and pharmacy going in the future, I believe that technicians will do more and more duties that's considered less clinical, that would help for the pharmacist to be able to do more and more clinical tasks and not have to do the day-to-day like immunizations, thanks to COVID, that technicians, there was a good thing that came out of COVID, that we actually was able to become immunizers. So that took some of the burden off of pharmacists, or they could actually continue counseling patients, and we could actually administer those vaccines after the pharmacist counsels and make sure that the patient's okay, there's no allergies or anything like that, so the patient is okay to receive that vaccine. And just different things like that where technicians are doing review under the oversight of a pharmacist. So I believe that if we're in the room, we can make this work together, and we can actually build our base and our foundation where we have great technicians that can move into those roles and that's competent, along with education and certification and experience. We can make this a career and not just where people just decide, okay, well, I'm just going to do this while I'm waiting to do something else. It's great that we have people in the area and in the field where they're going to pharmacy school. Of course, we want our pharmacists to get all the knowledge and education that they can, but we have a lot of people that are leaving the field, going to nursing, becoming nurse practitioners, physician assistants, and then some of them leaving pharmacy altogether because of one reason or another, or there was just a job in the meantime. So we want to let everyone know that this is a career and we can build for the future 5 and 10, 15, 20 plus years out. And it will be a great career. It already is a great career. And to just continue to help build and be in the know what's going on and help with policies and regulations and have a voice in the room. And I think that's very important for the future because, AI is coming along, so things will change. As automation comes in, a lot of different things will change for pharmacy. Some things have already changed because of COVID. We had to, pharmacists can do authorizations and verifications from home and just different things like that. And I just think as we progress we need to prepare, like different things that's going on is where technicians will be allowed to do product review and, help with labs and, doing the MTM appointments for patients and prepping the patient for the pharmacist. So, I think it's so far that where we're going, and that we just need to have a great foundation and just building blocks for everything to be well, for the technicians to actually be able to do their job and be able to work at the top of their license, just like the pharmacists. So I just believe that with us working well together, the pharmacists, the technicians, the students, and also with the rest of the medical team, the doctors and the physicians, and if they understand and believe that we are competent, that it's nothing that we can't accomplish. So a lot of automation is coming for the future. A lot of different things with tasks will be pulled off from the pharmacists and will be given to the technicians, and that of course, those technicians will be qualified to do those roles and those advanced roles and help support the pharmacists, the students, and each other. So that's my little take. Please consider me for your board.
For Technician Director, Courtney Willis.
Hi, my name is Courtney Willis. I am running for the Board of Directors seat for the technician role. I've been in pharmacy, September will be 25 years. And I work for Morrison-Dixon. I've been there for 9 years. And prior to that, I ran my own consulting business when we lived in Houston. And I've worked for a distributor and a buying group organization. One of the main reasons that I want to serve on the TPA Board of Directors is, as a current board member, I feel like there are still so many things left that we haven't accomplished. And I want to stick around to work on that, to get it done. I want everyone to be able to recognize that there is a spot available for them, whether they're a technician, whether they're a non-pharmacist owner, whether they're a pharmacist, infusion, compounding, independent retail chain, it doesn't matter. There is a spot for everyone in the Texas Pharmacy Association, and I want to help push that message further, as I have been doing. My vision for the future of pharmacy in Texas is, in addition to provider status, it would be nice to just have pharmacists recognized and as an integral part of the healthcare system. Fair reimbursements, let's start there. All the fights that we're having with the PBMs right now, that is something that we still have so much work to do, not only on the state level, but on the federal level. And I'm encouraging everyone to get involved legislatively as I go around throughout my tenure that I've served on the board. That's one of the things that I really do try to push to every person I encounter, that it doesn't matter who you are, what your role is, even if it's telling your customers to get involved, we really have to have everyone involved so we can push forward and support pharmacy.
For Speaker-elect of the House of Delegates, Clarence Richardson.
Hi, my name is Clarence Richardson, and I'm the pharmacy manager at the HEB Pharmacy at Hudson Oaks. I've been in the pharmacy profession for 16 years, and 10 of those years has been as a pharmacist. I've been a part of the Texas Pharmacy Association for quite some time, primarily as a member. However, I decided it was time for me to step up into a larger role within the organization so that I could use my voice to advance the practice of pharmacy. And so I'm excited and honored to run for the position of Speaker-elect. I've had various opportunities within TPA to advance our profession, such as going to the state capitol and speaking to state representatives on different initiatives and issues within pharmacy. I've also been able to write letters to our state representatives when it came to advancing the practice of pharmacy. And I've also been able to network within our organization so that I could learn how to use my voice effectively whenever advocating for our profession. And so I'm running for this position so that others can see that it's not very hard to advocate for our profession, and that we need to advocate for our profession, and that when we use our voices together, we can move things forward. We saw during the pandemic some of the opportunities that were offered to us to be able to take care of different initiatives. And I want to keep that momentum moving forward by stepping into this role and hopefully helping other Texans by taking care of them the way we know we can. Again, my name is Clarence Richardson, and I'm running for the position of Speaker-elect. Thank you.
For Speaker-elect of the House of Delegates, Erin Broadhead.
Hi, my name is Erin Broadhead. I'm a pharmacist and part owner at Community Pharmacy. We are a family-owned independent community pharmacy with multiple locations in the North Texas region. Currently, I serve as the pharmacist in charge at our current location. Beyond dispensing, we offer multiple services such as compounding, both sterile and non-sterile, a pharmacist-led wellness and weight loss clinic, long-term care services and medical at home, medication synchronization, as well as other ancillary clinical services like immunizations and point-of-care testing. Before my career at Community Pharmacy, I was the executive resident at the National Community Pharmacists Association. I was housed in their innovation center where I helped launch and pilot new services at independent pharmacies across the country. And I also identified independent pharmacies that were offering new and novel ideas and helped share those key learnings with pharmacy members in the form of continuing education and non-CE webinars and trainings. I was also a part of the advocacy efforts and helped our community pharmacists to promote the profession of pharmacy and clearly communicate the issues that affect our pharmacies as well as our patients. I want to serve on the TPA Board of Directors as a speaker-elect, and I hope to accomplish and continue to lead our advocacy efforts and innovation within pharmacy. That is a love that is near and dear to my heart. I also want to continue to lean into the untapped potential of our pharmacists, both in the community, hospital, and clinical setting, in order to improve our patient outcomes along with the payment models to sustain those services. My vision for the future of pharmacy in Texas is to see our profession advance forward and get pharmacy back to the spot where we're thriving and not struggling to survive. I know we all have patients to serve in our various settings, and I want pharmacists to be the reason their wellness journey is successful. Looking back, my parents, Kelly and Nancy Selby, they were both involved in pharmacy associations, both at the state and national level. And with the help of their colleagues in the industry, they helped expand the practice of pharmacy to where it is today. And I want to see that to continue to push forward, and I want to be the reason and be a part of that effort as well for the generations to come. Thank you so much for your time.
To learn more about these candidates, please visit texaspharmacy.org/candidates.